saw one doctor who was operating a robot in order to do the surgery, and he started making the robot do a robot dance in the middle of surgery. Obviously, didn't affect the patient at all, but I think people get the impression that doctors are always serious and focused, and they are focused, and they're obviously not negligent, and they do what they need to do, but doctors do have a sense of humour. And So I'm Lacey. I left East Barnet School 6 years ago, and I'm now training to be a doctor. When I was at school, I had to do a lot of work experience to get into medical school in the first place. So I had to kind of prove that I was dedicated to it, and also make sure that I really wanted to do it. So I did a lot of volunteering at a hospital, in a clinic. I worked at a vet surgery. So I did a lot of that kind of thing. Then I got into medical school, and then it was 3 years of learning the science behind medicine, kind of, and then 3 years working in hospitals and trying out each of the specialties, learning a bit more about practically how medicine works and how to do the job when I get into it. The highs are probably, I really like talking to people, and obviously in hospitals there are a lot of old people, and some of them have the funniest stories and are the strangest people, and they're really funny to talk to. And as a student especially, you have to go and take a history from them as though you're the first doctor who's seen them, and try to work out what they've got. And while you're doing that, inevitably you end up talking to them about their life. And I met this 90-year-old woman who used to deal cards in a casino in Las Vegas, and she was just the most eccentric old woman I'd ever met in my life, and she was so much fun to talk to. I find that it's a little bit like Sherlock a lot of the time. When you're talking to a patient, it's fun to try and work out, you have to try and work out what they've got, obviously, but it's quite fun to do it. You find out why they're coming to see the doctor, and then you immediately get this whole list in your head of all the things that cause that symptom, and you have to ask certain questions to try and tick them off, and no, it's not this one, no, it's not this one, oh, it might be this one, maybe you should think about this. So it's kind of like detective work, which is quite exciting. And then obviously it's quite rewarding when you do manage to help a patient, and you do manage to make them feel better and see them smile. That's always good. I'd say the lows are, some doctors are quite arrogant. That's always going to be an issue. The problem is, some people go into medicine because they're really compassionate and because they love people, and they make really good doctors. Some people seem to go into it for the money and the prestige, and those people are always quite difficult, I find, to deal with. That frustrates me. My advice to people who want to get into medicine would be to get a lot of work experience, not just because you need it for the application process to medical school, but also because it's a good way to find out whether it's what you really want to do, because it's 6 years at medical school is grueling, and if you're doing that and not really enjoying it, it's going to be even worse. To succeed, I think you need to have self-confidence. Don't let anyone tell you can't do something that you want to do, and if someone tells you you should do something and you don't want to, don't be afraid to argue and to question. I think what made me succeed was having the confidence in myself to do exactly what I wanted to do, and not to be dissuaded by anyone.